Good afternoon. In the past 7 days, 5 individuals have tested positive for COVID-19 in our district, with one exposure from community spread. COVID-19 is in our district. We need to act now to help stop the spread and to save lives. Two of the individuals who tested positive are connected with Chippewa Secondary School in North Bay. The individuals were at Chippewa during their infectious period, meaning the students and staff in the same cohort as a positive case will be identified as contacts. The high-risk contacts have been informed to self-isolate, monitor themselves closely for symptoms, and to be tested for COVID-19. All high-risk contacts of a case of COVID-19 are required to isolate for 14 days from their last exposure to the case. If the contacts develop symptoms within their isolation period, the isolation period may be lengthened. An outbreak has not been declared at Chippewa as the two cases do not have an epidemiological link, meaning they are not in the same class or cohort and transmission took place outside of the school. This aligns with the Ministry of Health's definition of an outbreak in a school. So now we're going to move on to some questions from the media. First question is from Greg Bowman at Moose FM. If a student who is homeschooled tests positive, does it get recorded as a case at the school? Well, from a public health perspective, children who test positive who are homeschooled do not impact disease transmission at the school. They would be counted as a positive case in the health unit's district count. It's up to the Ministry of Education to determine if they are counted as a homeschool student in their case count. So that question would be best answered by them. Second question from Greg Bowman at Moose FM. How large is the backlog of test results locally? Testing results take between 4 to 10 days to receive. However, the acute care system in Ontario Health are responsible for COVID-19 testing, not public health. Public health is responsible for COVID-19 case and contact management once the test results are reported to us. From Chris Dawson at Beta Day, can you comment overall on how schools are managing the protocols so far this fall? Schools are doing very well managing the protocol so far. The health unit has worked extremely closely with the school boards, and the boards have ensured administration at schools are well informed. Our call center specifically for schools remains open should any clarifications be needed. We're also supporting our schools with public health nurses should they require COVID-19 specific support. From Alana Pickrell of CTV, are these first school-related cases in the city? Yes, they are. The two individuals who tested positive are the first school-related cases in our district. From Alana as well, from CTV, is there concern that there could be transmission within the school? Yes, there's always concern that there could be transmission within the school. Individuals who have been identified by public health as high-risk contacts have been contacted by the health unit and will be self-isolating for 14 days and not at school for that period of time. We've determined that the individuals were exposed to COVID-19 outside the school. From Alana as well, CTV, in the original release, it was stated the risk was low at the school. Why is this? The investigation indicated both students were infected outside of the school setting and transmission was not likely within the school. Since these students were infectious while at school, individuals who were identified as high risk have been contacted by public health. All others in the school are low risk and should self-monitor for symptoms for 14 days. So thank you for those questions, greatly appreciated. I would like to conclude by just asking the public really to continue to follow public health measures. Travel outside of the home should be limited to attending school or work if unable to work from home. Essential trips for groceries, medication, and medical appointments. And while we are still able to limit exercise and recreation to outdoor spaces where physical distancing is possible. Travel outside of our district, especially to high areas with high numbers of COVID cases, should be avoided unless for emergencies or urgent medical appointments. The only way to really reduce the risk of becoming ill and spreading the virus is to assume everyone we meet outside of our household has COVID-19. and ensure we follow public health recommendations to stay safe. In addition to the previously mentioned recommendations, please practice 2-meter physical distancing, use a face covering, wash hands frequently, and use alcohol-based hand sanitizer often. Cough, sneeze into your sleeve, avoid touching your face, and stay home from work or school if you feel ill or if you have COVID-19 symptoms, and arrange to be tested. No one can predict how severe or how long the second wave will last, but if we work together, we can help reduce the spread and save lives. So thank you very much for attending and the questions that you submitted. Thank you.